And welcome back, everybody. If you have a pet, dog or cat, you want the best for them. Sometimes they can have some physical challenges. It's almost like you look at these animals and they're always running around. They have so much energy. It's like they're bionic, but they're not. And we have to realize that sometimes. We're going to address weakness in our pets and really understand what makes a move. And she is a pioneer in canine physical rehabilitation in New Mexico. She started a wonderful clinic, and she's our go-to for that. Dr. Laura Hady is back with us on the program. How you doing today?
Great. I really want to delve into this topic because weakness is one of my most common presentations that I see in my physical rehabilitation practice. So it can be any breed of dog, it can be any type of cat, and it encompasses so many things. We've already delved into arthritis. So I think what we'll do is we'll just talk about causes of weakness and how we can help our animals stay strong as they age.
Would you say, and we're going to go into detail what the key parts or components, body parts on our animals do specifically, but would you say that pretty much every animal has a weakness? We may not see it, but it's there, and they make up for it. If they have a weakness in one leg or a paw, they have three others typically. Do they all have something?
They almost all the ones that present to me have something. And so what we have to do is we as humans put an emotional part into that. So dogs don't collect workman's comp, and so they don't look in the mirror or feel sorry for themselves. Same with cats. They just keep on going. And if we think of their bodies as like a moving building, that's the easiest place to start. So the bones are there to provide support. They're like the steel beams of the whole project. And
Hmm.
when we look at the muscles are kind of like the powerhouses. They create motion. The joints allow the bones to move. And so they're important as well. And then we go into, say, like our nerves within our muscles. They're like our own little networking system, our computer systems within our buildings that keep things flowing. But it's all dictated by the brain, which is the key logistic center of what we and they need to do to keep moving. But what we often kind of forget about are those little alarm systems that are in the body, and they're little receptors that can be located in our skin and other parts of our brain, and they are things such as mechanoreceptors that feel pressure. So we feel pressure within our fingers. We also have to have, and dogs especially, is proprioceptors that tell our body where that limb or that leg is in space. And some of them are located within the skin. The ones that we sometimes forget about are the ones that are located within the inner ear or behind the inner ear, and that's where we may get vertigo. So that's the whole thing about we may feel spinning or whatnot. So that's an important key into knowing where those limbs are in space and being able to move them. And finally, we cannot forget about the super alarm system or the fire alarm system, which is the pain receptors within the body. And so pain is one of those things that tell us to and animals to stop what they're doing. And so they're an important feedback mechanisms for our animals to move and move correctly.
Wow. Um, you're not an animal communicator, but before we press on, I'm curious, do you feel that they know that they have a limitation? So let's say they have a little sprained um, paw, something going on there, something's different. Do you think they're aware of it?
They are aware of it. That doesn't always stop them in a high stimulus moment. So my dog was paralyzed in his back legs due to an accident. He was hit by a car. He was rescued, and he didn't feel his back legs at all. Very severe spinal cord injury due to a fracture. Now, definitely, he knew he wasn't quite right and that his back legs didn't move properly. But you put a rabbit in front of him and he would take off. He didn't care if he was dragging his back legs or not. So they are aware of it to a certain extent.
Hmm. So aside from arthritis, which you've mentioned before, what causes weakness in our pets, in their joints?
So the big thing that causes weakness that I see obviously is we start talking about the neurological system. And so that is comprised of the brain, the spinal cord, and the nerves that go out into the muscles. And so we all have back pain at some points in our lives, but I think animals just approach it in a much bigger scale. As we said before, luckily they have other limbs to move on, and so they just go about their merry way. So the spinal cord or the spine itself consists of the vertebrae, which are the hard bones in between, and they have shock absorbers called the disc. And the disc is essentially like a day or two old jelly donut. So on the outside, you have the firmer collagen. On the inside, you have the jelly or the spongy kind of material. And what can happen with these guys, particularly in these smaller breed dogs, so we always think of long back, short, crooked legs, like the dachshunds being the poster child. We have poodles, chihuahuas, French bulldogs, which are now popular, even pit bulls to a certain extent. And what can happen with these guys is instead of having a nice circular disc, they may have an abnormal C-shaped disc. And that disc can also be calcified earlier than it would uh, even with us or even with a normal dog. And so now we don't have that spongy jelly donut anymore. We have something that's a little more concrete and it's not doing its job absorbing shock. So when these animals jump off the couch, per se, that disc can rupture, put pressure on the spinal
Mm,
cord, the local tissues can swell, you get pain, and it just cascades down from there.
wow. Um, This is the stuff we don't think of. We look at a happy, joyful, loving ball of fur. And I think that this is my mentality. Almost go back to what I said previously. It's almost like they're robotic because they're always there. Listen, people complain, my back again, my knees are killing me. You don't hear it from your animal, so the perception is they're just going, they're great until they get much older, and then you can notice that they start slowing down a little bit. But you don't always see that they're in pain. I don't know if how do they do that? Do they hide it well? Do they transfer how do they do that?
Again, it's a survival instinct. I look bad or I cry out, that's going to draw attention in the wild to themselves. And so with
Yeah.
the cats, they're well known to hide under the bed until something's really wrong, or they hide their ability to jump up or use their tail as a balance, and they can have certainly disc disease as well. So we have to think about what happens now. Certainly we with these smaller dogs, we've bred them to be a certain way in this, and they get the acute things. I mean, they'll get to a point where they don't feel you touching their back, they don't feel they can't move their legs, they can't urinate and defecate properly. They can either overflow their urine, dribble urine, same with stool, and they may lose that perception. Basically, if I go ahead and clamp the toe, you have that withdrawal reflex, right? So it's the hot stove, right? You automatically withdraw that limb. Or say you're at the doctor and you do the knee jerk reflex. They do that little patellar hammer on your knee and you jerk away. That's just a message going to the spinal cord that goes right back to the muscle. So that's a simple relay station. It's not necessarily going up to the brain. When you or a dog loses deep pain, they basically, I can clamp in on that toe and it may move away as a reflex, but they may just, like my dog, basically not even look at me, not even vocalize or yelp, or not even try to bite me because they just can't function using their back legs or even sometimes their front legs. So
Oof.
that's the acute part of it. So we have to think of those German Shepherds and those Labradors. The bigger dogs tend to be more like us with chronic back pain.
Is in your line of work, are you able to identify just by touching an animal? Like, I'm sure you do an evaluation. Do you come upon, where you see the dog or cat wince a little bit when you hit something?
Right. So we are taught to do a neurologic exam. And that includes not only looking things that affect the brain, and our big nerves, our cranial nerves in the face and whatnot, say the ears and how our eyes work. We also have to look at things that how the spinal cord works and how the nerves that come off the spinal
Mm.
cord look at the muscles. So we may do things like a light stroke on the back, and in some of these dogs, the skin should twitch or the muscle should flinch or whatnot. And getting closer to that area where you have that ruptured disc, they're not flinching as much anymore. And we may do things like knuckle the foot over, basically, to have it turn back into normal position. And what happens with that is that the dog can't turn the foot back over. It's not getting that relay station to turn that foot back over. And so that's part of that exam. We do the knee jerk test to see if the response is too much or if it's too little.
Wow.
And we may also do things like cop them or even check like their rectum to see if there's any tone in there. And so we have a whole set of things that we are taught to do to go through it symptomatically, to help us make a diagnosis. And obviously pain's on that list.
So in humans, and I can speak to this, that as we get older, you start feeling things and things change. I know like 2 years ago, I thought I was in great physical shape. I really was like crushing it. Life changed, sitting more. Things changed.
Mhm,
Like they say that sitting is the new smoking.
mhm.
So what do? You do stretches, especially as you get older, just to retain your mobility. You work out. What can be or what is done in an animal to combat that weakness, as they get older?
Right. So some things that go along when we get older is we don't create new muscle tissue. And so we lose that and we lose muscle mass. If we are sitting more, we're not using the muscles of standing or those extensor muscles as much.
Yep.
So basically, I go kind of on 8 main pillars of exercise, and you can kind of key in where you may be doing some of these same exercises. So the first one would be a push. So in the equivalent in a human would be a push up, right? And so in a dog, you're like, dog or a cat, you're like, how are you going to get a dog or a cat to do a push up? So basically, what we're doing with them is we're getting them to what we call sit sternal or lie down in the sphinx position where their elbows and their knees are flexed. And we're going to use that potential energy. Say they're kind of floppy when they're even laying down, they can't even hardly get up. We put them in that flex position so that they have that potential energy as we bait them with the treat to get up, that they can use that potential energy to get up and stand. And then we give them a treat, have them stand for a little bit, and then we have them drop back down. The other
Hmm.
thing they can do is they can push an object. And so we teach them to push, say, a small exercise ball or a peanut ball, and we'll have them push it with their front feet while their back feet are on the ground. And we get them until they can't push it any further or they go kind of up and over that object. So that would be the push, would be the first one. The
Oh,
pull is like, okay, how are you going to get an animal to pull? So they can either pull forwards or they can pull backwards. Now, you think of those big Bernese mountain dogs pulling something like a little sled and whatnot. So what we do is for little dogs, we'll use a planter roller, and it's fairly strong plastic with wheels on the bottom. We'll attach 2 screws and basically attach leashes to a harness and have them pull that forward. And we may weight it with a little bit of, say, a rock on it, just very mild movement. We wouldn't want to do this if they're acutely hurting, but that's a good one to do. And we may have them also do walking backwards, like humans have to do, particularly when they're having Achilles tendon issues. So we get them to walk backward. That also teaches,
wow.
hey, where is that? Where is that leg in space? I'm having to do everything in reverse. So it uses our brain a little bit more in how we move.
Um, You mentioned sciatica before, so I was kind of surprised that the animals deal with that as well. Um, do they deal with a lot of same things that we deal with?
They do. They just have the other three limbs to deal with it, and it can fool you with sciatica because it's some of the same things we may see in a joint problem. So the way we differentiate it is through that neurologic test. But these dogs don't want to jump up. They may not want to jump down. They're more uncomfortable sitting because you're putting all that pressure on their spine to have a sit down. And so with these dogs, sometimes what we'll even do is we ask them to sit, we'll put pillows underneath them. So it's kind of like doing that wall squat where you have that your back's up against the wall and you flex your knees and you're holding it there and you're really working the quads and the hamstrings and the glutes. So that may be one exercise we help dogs with sciatica get a little stronger. Also, we some signs we may see with it is they may not wag their tail as much anymore, and that kind of helps me differentiate. You'll have a dog with bad hips, but or a bad knee, but their tail should still wag. The other thing that we may be looking at in a dog that may be a little bit different in particularly sciatica is you take the dog for a walk and the dog can move its leg, it doesn't knuckle or scuff, but then the dog just wants to stop the walk early. So those are
Hmm.
some considerations to think of with an animal with lower back problems and sciatica.
As somebody who is a veterinarian and works on physical rehab and all of that, uh, I have to, aside from your training, I have
Mhm.
to think that treats and food are your secret weapon.
Always, always. So basically, when I got into this 20 something years ago, in the training, they didn't have a lot of animal rehabilitation clinics to go to get training, right? You do your hands-on, you do your didactic classroom work. You have to spend so many hours. And so I went with human physical therapist and worked at the outpatient clinic at the local university. And the first thing the physical therapist told me is he goes, you have to learn what motivates the animal or the person, right? And so obviously praise is good. So the physical therapist that gives you the mini Snicker bars for doing your workout, you're going to like that physical therapist a little more. So obviously
Hmm.
I already use treats to help within the vet practice, but he goes, there's other motivations. Praise may be a huge motivation, particularly for people. Hey, you're doing really good. Keep up at it. You know, it may be a specific toy or getting to go do an activity later. So definitely use a lot of treats and dogs that have specific allergies. I have to carry a whole plethora of treats and be prepared to
Well,
motivate them.
just like the rest of us. It's so funny. Yeah.
Exactly, like a coach.
Yeah. It's like we don't have the training you have, but that's what motivates. And I always have them in my pocket. I'm going to gravitate for a moment. And this is out of our wheelhouse here, but do you believe in animal communication?
Yes, I believe in animal communication. The main thing is that dogs give uh, a lot of nonverbal cues. So it's the position of their eyes, the position of their mouth, the position of their body, and how they react to you.
Hmm.
So, for example, if I have a very scared dog, we'll get whale eye. We call it whale eye because you can see the whites of the eyes of the dog more, or the position of the mouth. Am I seeing teeth? Is the dog relaxed through the mouth? How is that? Where is that position of the mouth? And if you can reassure them with your voice, with how you touch them, with uh, having their owner relax, those are key things with animal communication. When I have clients come into the little casita where we do rehab or in my other thing, I would ask everyone to sit down. And you think something as little as sitting, but when we stand, we take a more dominant view. When you sit down, even the dog sees that as a relaxation type of thing with them. And so, how am I going to communicate trust with this animal? And how are we going to communicate, hey, we're here to make you feel better? And how can we make you feel better?
Wow. Um, I've learned a lot, so much, even in just a few minutes about our animals and what they're going through and how they may hide it or mask it. Um, you made it very clear, especially when it comes to predators. They don't
Mm.
want you to know, even if you're their person, because it's instinctual, that I got a problem here. I can't dart, I can't run fast. So I'm gonna make up for it in other ways, just so nobody knows what's going on here. In a way, it's fascinating. In a way, it's kind of sad because they're masking what could be pain that you might pick up on, and then you can get them the proper treatment and care, right?
Right. And it's something as simple like um, the position of their ears. Are their ears at normal attention? Are their ears laid back? Is their tail up? Is their tail down? Are they, like we said before, are they wagging their tail? And
Mm.
so you've got to get work through that. A cat will often become flat as a pancake, and instead of running away from you. So we get all those things started within the first 5 minutes so that
Oh,
we
wow.
can move on and have a successful appointment. We may even do, we've mentioned this before, hide and seek for treats. So we may put treats in the room and have different levels and inside different objects to have them crawl up and over an object to get them to move and to use their neck muscles more. We may take a treat from their nose and have them follow that treat side to side, basically with both their neck and their spine muscles to flex those muscles and to use that spine a little more effectively. We may also have the treat at their nose and have them stretch up and forward for that treat to extend that neck and extend those spine muscles. So those are very important stretches that we may do with these animals.
What a great idea. I'm
Mhm.
going to do that later on with my dog.
Mhm. Yeah,
Yeah.
he is, I'll often have them, if your dog was taught to sit for a treat, I'll just put my hand in front of their two back legs so that they don't go in that sit position right away for the treat and that they can stretch forward without taking a step. So
Wow.
those are two key things you can do with your animals to help them stay in that strength and stretch mode. We may
Hmm.
also, for teach them how to sidestep. So we may put an object in front of their nose, have four objects under their feet, take it, golf clubs, baseball bats, broomsticks, two by fours, you name it, have the treat at the nose, have the owner on the side opposite the direction you want them to go. And then just, they don't look down at their feet. When we're learning to dance, we look down at our feet. They just, as we push them sideways, the treats at their nose are going to follow that treat. And so now they're abducting or taking that limb away from their body, and they're also learning how to place that limb in a specific position for them.
I've learned so much. Seriously, tonight, that's what I'm doing. I'm going to use treats to get him to do different things and just what a fun exercise too. Just hide treats
Right.
and let him go on a, scavenger hunt, where might have to go up to get it here, might have to crouch down to get it underneath the couch or whatever it might be. Final question on that. Um, do they see where you're hiding them, or you just hide them and then set them loose and they find it?
Well, the thing is my dogs, the little puppies, I do let them peek out the window just a little bit. With the patients, I'll often just leave them in the room and I'll go out to the porch area near the casita and I'll hide them in various places. We have a lot of actually scent dogs that we work with core strength on, and so these animals are already trained to find things very rapidly. But any dog can do that. That's the neat part about doing things like a scavenger hunt for them. So some dogs I don't let them see. Some dogs I let them peek just a little.
Cool. What's your website? Somebody has a question. Certainly, in the greater New Mexico area. Where specifically in New Mexico are you?
I'm up near the Albuquerque area, so where the Balloon Fiesta is coming up in October. I'm located in a suburb called Rio Rancho, New Mexico. Don't have a website, but my email is k9profnm@gmail.com, or they can text me at 505-280-5962.
Got it. Yeah, it's right up on the screen there as well. Uh, Laura, great talking with you. Thanks for all the insight. Fascinating, fascinating, and just gives us a better understanding of what our animals are going through, and then how we can better support them. Appreciate you being here today.
Thank you so much, Steve. Look forward to the next episode.
Same here. We'll be right back.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, I mean, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.